All right. Hello, welcome to all of you watching and all of our panelists and participants in this panel. Today we are talking about trans and non-binary voice work and how that relates to quality of life and health. So we will look at this both from a clinical perspective and a research perspective. I'm going to get to introductions in a minute, but as Indigenous Peoples Day was this week, I'd like to start off with a land acknowledgement. So I'm going to read off this acknowledgement from the Native American and Indigenous Studies website at UT. And the land acknowledgement is its own tab, so you can go ahead and find that there directly if you would like to use this for your own events. As a flagship institution in our state university system, it is important that the University of Texas at Austin demonstrate respect for the historic and contemporary presence of Indigenous peoples in Texas, and particularly in the greater Austin area. To that end, it is incumbent upon the University of Texas at Austin to recognize that our campus resides on what were historically the traditional territories of Indigenous peoples who are dispossessed from their homelands. Land acknowledgements are an expression of gratitude and appreciation to the Indigenous peoples, the traditional caretakers of the land, for the use of their lands on which we work, study, and learn. In this spirit, we encourage all the faculty, staff, students, and guests of the University of Texas at Austin to open public events and gatherings with the following land acknowledgement, and or to include the statement and printed materials associated with your events. 1. We would like to acknowledge that we are meeting on the indigenous lands of Turtle Island, the ancestral name for what is now called North America. Moreover, I would like to acknowledge that the Alabama, Cashuta, Caddo, Carrizo, Kamacrudo, Kahultican, Comanche, Kickapoo, Lipan Apache, Tonkawa, and Isleta del Sur Pueblo, and all the American Indian and Indigenous peoples and communities who have been or have become a part of these lands and territories in Texas. In recognition of the ongoing and cumulative challenges faced by Indigenous peoples in Texas and globally, we call upon the University of Texas at Austin to repatriate the ancestral remains held by the Texas Archaeological Research Laboratory to their Indigenous descendant communities and native lands, to commit to the active recruitment and material support of Native American and Indigenous students who currently comprise fewer than 0.2% of UT Austin's student body, to support the transition of the program in Native American and Indigenous studies into a center, to establish a protocol of research and study on tribal or native lands, and to foster an ethics and practice of engaged scholarship with and for Indigenous peoples and communities locally and internationally. Thank you all for listening. Okay, with that, I'd like to open the floor and introduce our panelists. So today we are welcomed by a steering committee member of the Pop-Up Institute and quantitative researcher, associate professor at the School of Public Health at University of Texas, El Paso, Dr. Aurelia Loza. Thank you for joining us. We have a speech language pathologist and associate professor at the Health Sciences School at University of Texas, El Paso, Dr. Patricia Lara. Thank you for joining us. We have two mental health professionals based in Austin. We have Sam Clubb, who is an LMSW and works in group therapy at Out Youth and Transgender Wellness Program. And we have Cassidy Lamanick, who is a LMFT and LPC, who also works with Out Youth and I believe the Transgender Wellness Program as well. If I have misspoken at all, please correct me, but I'd love to open the floor for introductions. So Dr. Loza, if you'd like to introduce yourself and talk a little bit about what you do and how you got involved with sexual and gender minority research.
Hi, everyone, and thank you for being here. My name is Aurelia Loza. I am tuning in from El Paso, and I also want to acknowledge that I am living and working in Isleta, Tigua, and Mescalero land, among other groups, which I unfortunately haven't been, I'm not aware. So thank you for promoting land acknowledgement, Yona. I am in public health sciences, and recently, or in the last couple of years, started working with Dr. Lara on voice related outcomes for transgender people. But in the past, I've been working in LGBT health and transgender health, just understanding what are the needs locally here in El Paso and trying to identify providers that are open and competent and trained to provide services to them.
Thank you. Dr. Lara, would you like to introduce yourself? You're on mute.
My name is Pat Lara. I am an associate professor in the speech pathology program at the University of Texas at El Paso. And as Dr. Losa mentioned earlier, her and I started working together on research related to voice affirming outcomes in the transgender population, I guess about 2 years ago, right, Oralia? And the way Oralia and I are in the same college, and yet we didn't know what, I didn't know what she was doing. She didn't know what I was doing. But it's a good thing that we got to meet each other and to start working together. I actually, I started out my research career doing research on neuroplasticity in people who had suffered brain lesions. And, but I also teach the voice disorders class at the university speech pathology program. And I got a call I guess about 3 years ago, and a woman was a parent, and she said, I need accent modification therapy for my child. And I said, you know, I don't do that. I don't work with accent modification. Because actually to me, that's kind of boring. I didn't say that to her, but that's really what, to me, that is what I thought. And I thought, oh, I don't want to be doing that. And she started crying and she said, I really need help. And someone in the community said that you could help me. And so I asked her, well, what is exactly that your child needs? And she said, I want my child to be happy, and I want my child to not try to commit suicide again. She said, one day my child will succeed. And so I asked her, what is it that is going on? And she said, well, my son thinks that he's a girl. And I said, oh, you have a transgender daughter. And she said, so you do know? And I said, yes, I know about that. I teach that in my courses. And so she said, please help me. And it was the first time that we had actually did any type of clinical work in our program with any transgender or gender diverse persons. And so we saw her, we started to open it up to the community, and we started working with one of the endocrinologists in town, who at the time had a clinic at the Texas Tech Health Science Center. And it just kind of took off from there. So now we have a clinic in our program. The students that work in the clinic, they're all graduate students and they're all volunteers. So we have had an increase in the number of students that are volunteering in that clinic. We started out with 3, and then 4, and then 6, and now at the present time we have 12, which is half of our first year graduate students, and we have 6 of our students that are getting ready to graduate working in the clinic as well. So that's really how I got started on this.
Thank you so much, Dr. Lara. I will definitely be asking you more about your experiences as an educator and a clinician later on in our panel. Okay, Sam, if you would like to introduce yourself and talk a little bit about how you got involved in this work as well.
Sure. So hi, I'm Sam Clubb. I use both she and he pronouns. I just kind of do this and flux constantly. Um, so I got into this work, well, one, just kind of identifying as part of the community myself, and then knowing about Out Youth kind of whenever I transitioned from my undergrad to my graduate program and knowing Out Youth existed. And then it became my sole mission to work there because I wanted to kind of, I guess, work with folks that I guess were kind of like me, or like kind of be able to be the me that I would have liked to have had when I was younger. Um, and so by doing that, I got involved. I run their groups. So I run a gender identity group for kiddos between 12 to 18. And I help with the adult trans wellness groups, which are open to 18 until as long as you can go. We have folks that are in their late 70s that come even. So we have quite a range of ages. And during this, you know, kind of learning about all the facets that go into, you know, this population's needs. So I also will do name and gender marker changes. I write letters for surgeries because that's, you know, a reality currently is you need however many letters in order to obtain gender-affirming surgeries. And then I have a lot of clients that really have a lot of interest in voice therapy. It's a very large source of dysphoria for a lot of our clients. And honestly, it's a personal one as well. It's a very important piece of that puzzle. And so we've kind of, you know, started to build the relationship with Yona that way.
Thanks, Sam. I should disclose that I am a peer-based voice specialist and I work with the Transgender Wellness Program and Out Youth as well. So I am connected with that nonprofit. All right, Cassidy, would you like to introduce yourself a little bit further?
Sure, I'll be kind of brief in the interest of time. So I'm Cassidy, I use they, them pronouns. I'm a therapist with Out Youth and in private practice. I primarily work with parents of trans youth. I also work with adults, trans adults, queer adults, and youth as well between the ages of 12 and 18. And voice therapy is part of the work. I've been doing it since 2015. And I'm really glad to grow my knowledge base around it and get more and more referrals and help people move through whatever kind of affirmation they may want or need at that time. So really appreciate the work. And I really appreciate Yona very much. So I'm happy to be here today.
Thank you so much, everyone. And we'll just get started. But again, yeah, so my name is Yona, I use she, her pronouns. I'm going to moderate this panel discussion. So I think the first place to start off is talk about demand. So my first question is going to be to Sam and Cassidy. I'd love to get your perspective on, with your work, with individuals, with groups, with case management, what can you tell us about the need for voice therapy for gender variant folks?
So there's a high demand, very high demand actually. So I also run our case management program at Out Youth, and a lot of our referrals folks are very interested in voice therapy. And we have a few different voice therapists connected to our organization, and we will refer. And it's one of those things that folks also don't tend to know a lot about. A lot of folks have a lot of questions about, okay, well, what is voice therapy? What exactly can it do for me? Are there limits? Is it just for singing? Like, there's a lot of questions that folks have about it, but the demand is definitely high for what we see.
I would second that. A lot of, you know, it comes up in the work, folks expressing vocal dysphoria and vocal euphoria. And it's important to help people reach their goals, whatever they may be. And so knowing kind of the best avenues and making suggestions and helping support people through that journey is a big part of the work when it comes to voice.
Yeah, it's really important to take a holistic approach to gender care, whether or not that's a medical route of treatment in one's gender exploration, or it's therapy-based, whether or not somebody wants to go through with gender-affirming surgeries, whether that be vocal surgery, or whether that be, HRT, or just some therapy to address a certain aspect of the voice, such as pitch, or another aspect. So with that, I'd like to pivot to Patricia and ask you what you see for those folks who are initially coming in for work. I'd particularly like to ask you what kind of expectations they have for that work, and how do you work with trans and non-binary folks to meet a more realistic voice goal for your clinical work?
So we actually, I was just going to mention something that Sam said. We actually have a wait list because of the limited resources, right? That, I mean, I can't see them all because I'm teaching, doing all these other things, but because the students that work in our lab, it's all volunteer, we're limited by that, right? We're limited by those type of resources. But what we see is that sometimes we, of course, have more transgender women come seeking services from us than we do trans men. And that doesn't mean that trans men don't need to do some kind of work, but it's just easier for them to lower the pitch. However, we do have some of our patients that come in and they want to sound, they'll ask us if we can get them to sound like maybe Britney Spears, or they want to sound like someone that has really high-pitched voices. And we have to work on showing the individual, here are the differences between the anatomy that you have and the anatomy that that individual has, right? So that they can see that there's differences and there are limitations that are going to be there based on that. And so we tell them, we will get you as far as we can without causing any damage to your vocal folds, because that is not something we want to do. And we have not had a problem doing that, but we do have sometimes, we had one patient who kept saying, I want to sound like you. Well, I'm only 5'1", and that individual was 6'5". I was like, that's probably not going to happen because of the size of my larynx and the size of yours, right? And she eventually figured out that if she kept trying to go up higher, her voice hurt, right? And she said, yeah, I can't do that. So we did get her as far as we could, and she was happy with her voice.
And I think that also brings to the surface the other aspects of sound that we should really focus on as providers, as people who are providing voice therapy services. And I'd love to hear, Pat, from you a little bit more about what you focus on with your clients, with your clients who are assigned male at birth or clients who are assigned female at birth. Either way, what aspects of sound do you focus on with them?
So we work on pitch, right? Because that is really initially all of our clients or patients, they all come in and that's what their goal is, to increase their pitch or to lower the pitch. And we will work with that initially. Once we get them to where their pitch is at the level that they want it to be, then we talk about, okay, so this is not the only area that is going to give you that feminine voice or the masculine voice. We also have to work on resonance and communication style and even rate of speech. And even for some of our clients or patients, we even have to work on articulation, how they are going to move their sound forward, right? So resonance is a big, one of the big areas that is not well researched, but which those people that are doing work with transgender voice affirmation, they do say you have to work on resonance, and the WPATH also sets that as part of their guidelines.
Yes, thank you for sharing that. I definitely emphasize resonance probably the most with my clients, and second to that is likely pitch, because that seems to be what clients focus on the most. And in initial meetings with folks, that's what they seem to be, is like the only thing, like, oh, I've tried to work with my pitch, but I don't know why it doesn't seem natural. And so we kind of try to debunk, like, so what is pitch? You know, what is a fundamental frequency? And then how do we achieve that through different resonances? And then how do we intone differently? And other ways of creating different gendered forms of communication, whether that's nonverbal or if it's your word choice, how you articulate things, or your diction, and then your sense of self. So how you communicate,
Right.
how you orient yourself, your posture, pace, definitely volume. So those are all big aspects that, you know, once we can get folks to start observing themselves, then I notice a big improvement in their ability to control their sound. But with that, we're kind of treading a line with mental health.
Yes.
And that's, again, I'd like to pivot back to Sam and Cassidy. It seems like these two aspects of gender care, mental health and voice therapy or voice care, seem to be intrinsically connected. And at a certain point, it seems hard to kind of differentiate the two. I'd love to ask y'all, what, from the folks who have sought out voice care or surgical care for their voice, have you noticed quality of life improvements, reduce anxiety, increase confidence, anything like that in your clients? Can you just elaborate a little bit more on the folks who have had these therapies?
Sure, I can go first. So yeah, definitely notice higher confidence in folks, and you know, more ability to feel like themselves out in the external world. With the therapy aspect of it, most folks that come to see me, they've seen me and then they'll go seek voice therapy support. I don't know if that's a typical route of like seeing a mental health professional and then seeking vocal therapy, but most folks are looking for resources. And so when someone indicates me that they are seeking that kind of change or support or affirmation, I tend to try to set a baseline of, okay, the goal is not to like change your voice, but the goal is to make your voice sound like you. And what does that entail? And so it's kind of a delicate line also of, you know, I want to help you increase vocal euphoria. So what does that mean? And kind of encourage acceptance, but not stasis. So thinking like, you know, taking the identity, for example, saying, okay, you know, I am non-binary. This is my voice. This is what a non-binary person sounds like. I'm a man. This is my voice. This is a man's voice. And getting that baseline and then going from there makes a huge change. And again, I don't want to discourage growth or say like, this is where you're at, and so you should accept that. It's more of, this is where I'm starting and where can I go? So I really want to encourage that for folks and help them find spaces that fit for them where they can do that. A lot of those spaces that I find are voice therapists, singing training. There's a big Twitch community actually of peer-to-peer voice support, which is really cool. YouTube videos, YouTubers who provide voice therapy and will actually like train their followers to help like spread that out. And so helping people find what works for them is also very rewarding, and then letting them find spaces to practice too. And in therapy is a great place to practice. And it's really, really fun to have someone come back in and like practicing sounding like themselves, and they're just like so proud, and I feel so proud, and it's so wonderful. I feel really honored to be there for that part. So yeah, I think mental health and voice therapy, it goes pretty close together.
Yeah. I would have to agree. Totally. Yeah. Because that's what we see. We see that when the clients or the patients are successful, yeah, they come back and they're very happy. They'll send us pictures. They'll, one of our patients told me, "Thank you for letting me be who I am." And that was worth it for me. So, yeah.
And I can also echo this. Whenever we have clients that are receiving voice therapy or that have just had surgeries for their vocal cords, when they come to group and they are practicing, or they just start to, they glow. It's a glow. It's a, oh my goodness, this is my voice. This is how I'm going to communicate. And it's also, at least in the group space, a space where everyone else can also then provide this outer validation. It's no longer, oh, my therapist is just telling me I sound great. It's, oh my goodness, everyone else in this room can see this change, and I feel seen and I feel validated. And the more validation and the more they feel seen as themselves, and the more they themselves feel like themselves, the happier and the better off they're going to be overall.
Thanks so much, y'all. Aurelia, I'm going to bring you in just a second here, but just a follow-up question. So it seems like we're kind of dancing around this topic of peer work. And I think peer work is just essential in queer health in general. But as a peer-based provider, I am a huge advocate of it. And so I'd love for us to dive into that just a little bit more and talk about how effective peer-based work is. And I first would like to address this question to Sam and Cassidy as folks who are working in a queer nonprofit. People who you work with, you may identify as peers, and people who you serve may identify as peers. So I'd like to first ask y'all what kind of challenges you may see or have experienced as peer providers, and then I'd like to ask y'all also what kind of advantages come to serving in this role, this duality of being a peer and also a provider.
So I think one of the biggest challenges as being a peer and being a provider is it comes with a lot of countertransference. Because you see a lot of other people, what they might be struggling with may have been something you have struggled with, or may have had similar experiences. So there's a lot of emotional backlash that you personally get from it, and it kind of keeps you on your toes to kind of be really self-aware as to where you are, but at the same time, being a peer and working with a community that you identify with in a way also allows for folks to it gives you, in a way, I guess, a sort of validity to them, like, oh, you get it, you also might experience some dysphoria, or you're also part of this community, you've seen this happen, or what's happening in the world. It gives you kind of a different perspective that more closely aligns with others' experiences in that way, and kind of allows folks to relax a little bit and to gain some comfort and some safety with you.
I would second that. I think peer-based providers, being a peer provider in the community, makes you more accessible for many reasons. Accessibility meaning like low barrier, right? This person is less, unfortunately, it's like this person's less likely to reject me. So that makes it more accessible. And that's from client going towards me, right? But for me going towards the client, I find that I can like navigate these gray areas of like, I can find you support as not a professional, and we can go that way too. And that's, again, like bringing that barrier down, making it accessible. And that's something I really appreciate. I couldn't, you know, it's really hard and really gratifying trying to serve the community that you are in. But, you know, it's really important. It feels like communal is the best word, I think. And I appreciate that about it too.
Yeah, I would second that. It definitely seems like the gray area is enhanced, and those, I wouldn't say boundary violations, but boundary crossings certainly existing in a way where folks are reaching out on a personal level. And so for me, as a peer-based provider, I have to reiterate my boundaries from the onset. Like, listen, I'm not a therapist, but I'm here to hold space for you if you want to talk about something. So I'm here as a peer to talk about things that aren't related to my specialty and why you're seeing me. But at the same time, this is what we're focusing on. But at the same time, folks will look to me for anecdotal evidence or anecdotal responses of how my voice has evolved as a trans person. And they may try to compare their own progress to my trajectory and my timeline. And so I find that to also be a potential pitfall for folks, is to fall into this hole of, well, I've seen this on YouTube and this person had these kinds of changes within certain months of HRT, or this person had these kinds of changes within certain months of voice therapy, or it'll be so much easier if I get voice surgery. And so I find the biggest challenge with peer support is to break down anecdotal evidence and anecdotal progress of voice work in particular, but I bet it's applicable to other avenues of care, of gender care, is breaking that down for what it is just an individual's experience. And it does not necessarily mean that their evolution with their voice or their gender is going to be synonymous in any way, because everyone has such a unique gender evolution when they go down that road. So yeah, thank you all for that perspective. Okay, Aurelia, so sorry that you haven't been able to chime in, but let's open the floor with some research-focused questions. I'd love for you to give us a perspective on what the existing research kind of tells us about care. And it looks like you have a presentation popping up. So I'm going to mute and let you have the floor.
Okay, well, thank you, everyone. I am kind of going, I'm hearing a lot of expertise and a lot of information that is not documented in the literature. So what I'm presenting is based on what has been published in scientific journals, and it might feel like a step back in terms of knowledge and in terms of the needs of the community. So first, I'm going to skip a couple slides because they were mentioned already, but I had prepared some, I guess, citations for some of the work, but acknowledging what Dr. Lara said, primarily the experience is different for trans men and trans women, and it's primarily trans women that are seeking voice affirmation services. And but both have been understudied. And so I just want to mention that as a field, as an outcome, or as a in a clinical setting or in a social setting, it's understudied. Mostly understudied in a social setting, meaning how does the individual react to, or what are the experiences that change in a person's life once they have voice affirmation care. So that's definitely missing from the literature. So what I'm presenting is mostly going to be clinical. And so few studies have examined the impact of voice affirmation care in the lives in general, but the few that have, I'll mention what component that they refer to. But I think mental health is definitely important, but missing in the literature. Another thing that's missing is the impact of endocrine or hormone therapy on voice affirmation care. And also another area has been knowledge and attitudes among providers. So that's kind of going to be mentioned in some of the slides, but in general, it's been understudied. And, but it's been noted that the lack of awareness or the lack of exposure has made people in the field of speech language pathology feel like they can't provide these services, even though they're trained and can provide them. They don't feel like they can or should, because they don't have exposure to the population or knowledge specific to voice affirming care. And then the biggest hole in the literature, but also as a field, is that there isn't an evidence-based treatment protocol. So you all shared anecdotal experience and how you share that information, but having a protocol in place that has been tested to show effects in different clinical outcomes. And so that's missing, although guidelines do exist. It's not a evidence-based treatment protocol. And also acknowledging that there's other aspects of communication that are important to include nonverbal communication, for example, that contribute to perhaps femininity of voice. And so there's a relationship established between voice and gender expression. So it's acknowledged that it is an important component of gender expression, voice, and along with other characteristics, and also acknowledging in the literature that it can reflect a unique sense of gender, and it may be influencing outward appearance. And so when when voice is not congruent with outward appearance, then an individual being misgendered, and that's been associated with other things like violence and discrimination, etc. Voice feminization in transgender women suggests satisfaction. So in general, when people receive voice affirming care, they are satisfied with the changes that they experience. And in this specific paper, they were looking at transition. And so they had quantified like what is a successful transition, and that voice was an important component to that process. And also in terms of gender expression, another study looked at that having congruence between voice and gender expression did impact quality of life. So this is now a marker that's outside of the clinical setting, but still assessed in clinical settings, that give us a clue from scientific research that it doesn't impact people's lives. Most trans women achieve vocal improvements when they receive vocal affirming care and are satisfied with the training they received, as mentioned before. In clinical settings, it appears to be based from a 2008 paper that might have changed, that fundamental frequency or pitch is the most important clinical factor, but as mentioned, resonance is another important factor, along with nonverbal communication, linguistic, and other components of voice. And so this paper had the title, "Giving Voice to the Person Inside," and I want to quote them. They say, when outer expression is congruent with inner sense of self, transgender people may find increased comfort, confidence, and improved function in everyday life. So again, it's linking to quality of life or improving quality of life as a factor impacted. They also mentioned that people's goals in terms of voice may change, and that's something that's important and mentioned in other studies. It's like personalizing what is considered success or efficacious treatment. So it's not guided by the clinician, it's guided by the participant as well. And so they gave an example of how the goals might change after gender affirming surgery. And so taking into account, I guess, experiences that might impact changes in goals. And specifically in speech language therapy, in this article, they mentioned that the fact that there's little or minimal standards and protocols, and in terms of how do you measure success in treatment. So that was mentioned there as well. And again, mentioning that the goals change over time for voice and communication. This is based on the US Transgender Survey that was conducted in 2015, and they asked questions about voice, surgical and non-surgical, among those that that identified as being assigned male at birth, and 11% of them had ever received non-surgical voice therapy, and it was the second most common reported procedure underwent by this group. And in the second and third plot, we see that close to half of transgender women and close to 1/3 of non-binary participants wanted to have voice therapy someday. So pointing to the demand that was mentioned by Sam and Cassidy. So the demand is there and documented in this national survey. Happiness with self-perceived femininity of voice. That is an assessment in a clinical setting. And so in this study, there were 12 women, and they showed there was a relationship between the patient's happiness with their voice and this measure of self-perceived femininity of voice. And they also found that there was a relationship that was a bit stronger in terms of naive listener perceived femininity of voice. But they did not find a relationship with fundamental frequency, which we mentioned earlier was a clinical marker that tends to be addressed. And so they concluded that voice satisfaction may not correlate or be related to the perceptions of the voice professionals, but actually we can rely on the evaluation of the self. And it's considered a subjective measure, but patient satisfaction is reliable and can be integrated into therapeutic settings. And so we mentioned quality of life. Quality of life is one of the only measures, again, that's been associated with treatment. So in terms of mental health, this is as close as we get. It's just quality of life. But the quality of life instrument that's used is actually tailored for transgender individuals. So at least we have not just a quality of life measure for general population, but specific to trans individuals. And that's used in clinical settings. And it was found that a self-perceived quality of life was moderately correlated with listener perception. So that's when somebody else is listening to their voice, and strongly correlated with self-perception of femininity of voice. So again, their quality of life increases as the femininity and the likability of their voice increases, which I think is consistent with what you all mentioned earlier. And then I do want to share that these are results from a master's thesis looking at voice handicap, which is indicative of having voice problems. And you all can have a better understanding of this, but this was among 233 participants. So this is a larger sample size. We don't see large sample sizes in the clinical research. And this was a master's thesis. So I thought that was very inspiring for students that you can do important work. But here is, they had 3 groups. So among transgender women, they did not find that voice handicap differed between those who had voice therapy or hormone therapy, and that for transgender men, there was a difference in voice handicap between those who had experienced voice changes that were specific to hormone use. And yet they found that 39% had severe voice handicap. So there's kind of a need to understand how this apparently seems contradictory, but why was this the case? And among non-binary individuals, the relationships were not significant, and there were both positive and negative. So there were mixed results. And then the last slide I have is a paper on speech language pathologist knowledge and attitudes towards LGBTQ population. So it was not specific to trans individuals, but there was a section that was focused on them. And they had moderate levels of knowledge and moderate levels of comfort, and high levels of positive feelings towards the population. So in this particular group, however, in terms of transgender communication, although it's within their scope of practice, so again, people are trained, like Dr. Lara mentioned it, people are trained in speech language pathology to provide these services. 47% indicated that trans-specific services were not addressed in their curriculum at all. So I think we're in a unique situation here at UTEP where it is included, and 51% did not know how to describe transgender communication therapy. And so there's a disconnect between the professional training and the fact that they are trained to provide these services, but somehow they don't feel competent or comfortable doing so. And so they pointed to the need for, in general, LGBTQ cultural competence, but specifically within speech language pathology. And so I have a couple more slides, but they get more, what do you call it, like theoretical. So I wanted to keep focused on these more practical slides. And if anything was unclear, please let me know. But Yona, you did mention the term passing and how that appears in the literature, and it does appear, but it was very vague, and the relationships were not strong. And so I didn't want to include those slides here.
Well, thank you so much for that presentation. We're on limited time now. I know this is such a big topic, so we could only take a crack at it, and I think we did a good job at taking a crack at it. But I think with our remaining time, it would be great for us to just to have a little bit of a dialogue, open the floor for questions, and see where we end up. So if anyone likes to chime in, participants, panelists, or otherwise, floor is open.
I would like to make a comment. Something that you, Yona, talked about is the importance of peer providers. And I think because there's a lack of speech language pathologists who feel competent or comfortable working in this area, there's a huge need, right? In our area, El Paso is not a little city, it's a huge city, and we are close to New Mexico as well. And we have, we're a binational area. So we also have Juarez, and then we have a military base here. And we have, we do have a VA hospital here, and we have a military hospital here. And they do not provide any transgender voice affirming services there. And so we do see quite a few military folks seeking services, but I think there's a place, there's definitely a need for peer providers, because where are people supposed to go if speech language pathologists are not comfortable or do not feel competent doing this type of work?
Yeah, you raise a really good point, and I know we've spoken about this in the past. I am a firm advocate of peer support, and I believe that gender-affirming voice work is firmly in the realm of habilitative work. So long as I don't notice a pathology with a client, then I am totally comfortable working with them. But once something pops up, such as laryngitis or something like that, or chronic acid reflux or some sort of aphasia, then the red flags will come up, and it'll be crucial to get more help from a professional. But I think the peer-based model is theoretically a really good model to approach two major issues. So one is avoiding the major stigma that you may feel when approaching a professional who may be an out-group member. The other is convenience. So in rural areas or areas that are more isolated or areas that may have language barriers, working with a peer may be a way to solve those issues or get some treatment, whether you're following a YouTube channel or you're on Twitch or you're doing telehealth therapy with someone like me and you live in Cedar Park or something, or you live in Round Rock, then it's easier than to try to drive or, to navigate health at all right now during the COVID pandemic, for instance. So there's convenience factor in that. And then I'm glad you mentioned language. Language is also a major aspect that I notice. I speak 2 different languages. I speak Hebrew. Hebrew is a gendered language, and I have a lot of dysphoria around speaking Hebrew. And there are other languages that also experience a lot of gendered, formulations. And so people speaking Spanish, French, Creole in this area, you have a lot of people who are converging with different language. Texas is super homogenous in that way. And it's important to address people who are multilingual as well. And as someone who doesn't speak Spanish, I noticed the major need to address that. Yeah, any other questions, any other points anybody wants to talk about or ask?
I just wanted to mention that a lot of the experience and knowledge that you all have presented is missing from the literature. And so being involved in research might not be something you have time for, but it's something that needs to happen in order for both the mental health providers and the speech language pathologies can understand the impact. And so I just want to promote collaborations with researchers to generate evidence for the work that you're already seeing, or for the relationships you're already seeing, because there's a need for that to promote voice affirming care as part of care that maybe could be covered by insurance or something like that.
Because many times that's one of the issues, right? That it's not covered by insurance, and voice therapy is expensive. So we in our clinic do not charge for any of the services that we provide. But again, there's limited resources, so we have to do something to get that that part of the relationship that we see between mental health and voice. Really, there needs to be more out in the literature.
I would
I have
just
a question.
I'd just like to say thank you to everybody. This whole issue of transgender, it's new to me. It came and sat down in my living room with my transgender granddaughter, and so this is pretty much new, and I'm just gathering information to help her, to help myself. So thank you.
Thank you for joining and supporting your granddaughter.
I had a question if there's time, because I'm wondering, in thinking about like this mental health work and also the voice work, I think we easily just talk about gender dysphoria and don't talk as much about stigma and social norms. And I'm wondering about how to do voice work without reinforcing gender binary or reinforcing the idea that there's one right way for a woman to sound or one right way for a man to sound, and I'm wondering how you sit with patients and can validate desires and help alleviate dysphoria, but not at the same time, either directly or indirectly, promote the idea that you need to sound a particular way in order to be a successful person of the gender you are, and kind of what your approaches are for that.
So for us in our clinic, the goals are developed with our clients. So we had a little bit of a pushback in my program by some faculty who feel very intimidated, and they were saying, this is a very prescriptive type of treatment that you're doing. The students shouldn't get credit for it. And my thing was, no, it's not prescriptive. We're not telling our clients, this is how you have to sound. They are very much part of the goal development. It's their voice, not mine. How am I going to tell somebody this is what you should sound like? So that's how we go about it.
I think what you're asking is a really good question, but I think it's a tightrope. Like what Dr. Laura said, setting goals from the outset with folks and really being explicit, communicating like what are your goals for your voice, or if you haven't thought that far, trying to explore that in a safe space. So curating a space when you're meeting during sessions to experiment with these different sounds so that they can discover for themselves, oh, I like this pitch range, I like this resonance, I like it when I feel vibrations here or there. Then we can build off of that. But really, to the extent of, at least in my practice, I will incorporate gender theory and really talk about patriarchy and stuff like that, and how it's affected a typical binary female voice or binary male voice, what makes something masculine versus feminine. Why is a monotone sound not necessarily supposed to be just masculine, and how do we debunk that? Why do we typically associate somebody who raises their pitch at the end of a sentence as female? And that is something that we can really debunk, but it really depends on the client. If they're just very, very much like, I want to get down to business, I could give a damn about what the theory is, then it's really on them. It's what they want to make out of it.
Yeah, I would have to agree with that. Yeah, because I think for us, many of our patients come in with a specific, I want to have 400 fundamental hertz for my pitch, and they're set on something, and we try to work with them, but if they're just set, that's difficult to change.
Another thing is, I think, again, harkening back to what I said before, that I think voice journey is really intrinsically connected to one's personal growth. And as they undergo their own gender journey, they're also unfolding in this whole exploration of the voice. And you're kind of learning a whole new instrument as you are exploring your gender. And so for some folks, they may seem to think that gender is a very static, like I'm starting here and I'm ending there. And some people may see it as like an evolution, and it's really open-ended. How it evolves, where it goes to, or what the endpoint is, if there is an endpoint at all. So I think at the end of the day, again, it comes back to working with them at where they're at. So if somebody is hyper-focused, like what Pat said, on pitch, then okay, let's address pitch for now. That's what you're focused on. Or if somebody is really like, I have no idea what to do, I'm just feeling dysphoria, then maybe it's, let's focus on how you can feel feelings of vocal euphoria, and really deconstructing it that way. So I think that it's almost impossible not to confront binary archaic views of the voice, just like it's impossible not to address binary archaic views of gender and sex when we explore gender. It's just, it comes hand in hand. You learn a little bit of women in gender studies when you do this, because this is like, it's lived experience.
I have a question about just having gone digital, how that's affected accessibility, and how that may have affected, just like differences in pitch via having to learn digitally and that journey, and what that has kind of looked like since the pandemic.
I could address that because we're doing all of our work digitally. But you know, I think that it has actually increased our referrals, and it has our attendance to the sessions. Because first it's the clinician, the supervisor, and our trans folks, right? That's it. Nobody else is watching. And because we're a university program, we allow undergrad students or grad students to watch the sessions, right? As long as they're in the speech program. But I think that it has really improved that part of it. And the clients or patients that we see, I think, feel more comfortable. But you know, there are some glitches with sometimes we get kicked out of Zoom, or sometimes you know, the audio isn't working well and we have to re-record. So there are some glitches, but none of our clients have actually said, I don't want to do this anymore. I think it's too difficult. If anything, it has actually, the attendance has just improved. Yeah.
Any of our mental health providers want to speak to their experience with the digital services?
Yeah, so I find that digital services are harder for me to provide because I'm using a different part of my brain. There's so much in-person body language and cues that we can run off and that we run off of naturally that don't happen over a screen. And so I find for me, it's a lot more focus, and it's a different kind of fatigue in like being attuned to my client. And I find that my clients are having the same kind of growth point, kind of learning a new way of being with someone when they're on a screen. I wouldn't say I've had decreased attendance. The attendance has been fine for me. Folks have liked it more than they thought they would, so that's nice. Just the attunement has been a challenge, and finding ways to be attuned that work well for our setting, I would say. But otherwise, it's been really good.
I guess the only things I can really contribute to that is that it's allowed access to some of the different parts of our population. So before we were only able to really serve a lot of the Austin area. However, now we can provide services to anyone in Texas. So it's broadened our horizon in that manner. It also, though, has presented some accessibility issues. We have gotten, at least with our youth, we have had a significant drop in amount of folks who can use our services. Not everyone has a device at home that can connect virtually, or has a safe space to where they can connect to us virtually. And then with our adults, our population is also kind of shifted around as Cassidy mentioned, it's a different type of fatigue that we're seeing. But there's still definitely a lot of interest and a lot of folks still reaching out, and especially, recognizing that they need mental health support and voice support during this time.
Any last question before we call it a day? All right, I'd like to thank our panelists, our participants. Thank you so much for talking, for joining. I'm sorry we went 10 minutes over, but I really appreciate everything that everyone brought to the table here. Thank you for your questions. Thank you for your input. And I will let you all know once this video has been posted online. So again, thank you all so much. I hope you all have wonderful days.
Thank you. Bye-bye.